that Goa is one of those states in the country where even coiling is free of charge. Putting a pacemaker, you go outside Goa to any state, pacemakers, leadless, without lead, those new pacemakers also are being given free of charge, which cost something like 8 to 10 lakhs of rupees per patient. So there is no compromise as far as the patient care is concerned in the state of Goa. We have decided that in terms of what we want to do is like HMIS and all, these have become like usual stuff. But what HMIS means, just not keeping digitization of records in the hospital, but how do I link up all my PHCs, CHCs and see that the people don't need to move from those areas to always coming to the tertiary care center for help.
We've been doing this for the last 5 years. It's also an occasion to celebrate 10 years of the Healthcare Management Program. We've been a pioneer in launching this program 10 years back, and today it's easily the best ranked healthcare management program in the country. Students from this program have been recruited over the last 10 years by a variety of different industries, including top pharmaceutical companies, medical device companies, corporate hospitals, the government, health consulting firms, IT firms in their healthcare and life sciences verticals, as well as financing and health insurance firms.